Hello, everyone. Thank you for joining today's session and a very happy Doctors' Day to all the doctors, those who have joined the session today. Let's be a little energetic. No, doctor, we don't upload the session on YouTube. We upload the recorded session on our community. So I hope you're the part of the community. If not, I'll be sharing the link to join our community at the end of the session. So this 10-hour session, what we have planned, it's basically to give you a brief about what is MRCS, what are the most important topics, and which are the most scoring topics, and few more scoring MCQs, like more repetitive MCQs will be discussed. So today's guest speaker for today's session is Dr. Aishwarya. Dr. Aishwarya is working in Nimans Hospital. It's a government hospital of Bangalore. Many people, those who are in Bangalore, will be aware about Nimans Hospital. So along with that, doctor has completed her MRCS Part 1 exam, Part A exam in her first attempt. She scored 81%. And I'm sure that she will clear all your doubts. And few doctors will be having some myths about what is MRCS, when we should take, what is the process and all that will be cleared today.
Okay, hello everybody. I'm Dr. Aishwarya, and I'm currently a resident in Nimhans, and I will be taking live interactive 10-hour sessions on MRCS Part A. And let's get started. So basically about me, as I said, I'm currently a resident in Nimhans. And I have always loved surgery since the beginning of my MBBS to such an extent that I even took up suturing workshops in my first year. And yeah, so that has been my love for surgery. And that's why I tried and I looked up MRCS and I took up MRCS in Jan. That was my first attempt. And as you can see, I cleared it. So what I am gonna do here today and for the next few sessions is we'll bust some myths on MRCS Part A and we'll make sure that all of you get the help that you need to crack it. Okay, so coming to what are the right ingredients, right? So as other exams, it's not the same as NEET. I get this a lot. People say that I've been studying for NEET so much, or I've cracked NEET PG or INICET. Is it the same? Can I crack MRCS Part A with the same preparation as I have done for NEET? But unfortunately, the answer is no, because the sources here are completely different. Even though the content is the same, the concepts are the same, but the way you approach the questions are different. And because this is an exam that is based out of the United Kingdom, that is the UK, so their guidelines, their protocols are different. So most of the questions are based on NICE guidelines. And yeah, so the right sources are very important, and the preparation strategy, because studying for MRCS is actually very different. And there are certain things, especially as IMGs ourselves, as people who are not used to the NHS system, who are not based out of the UK and who are practicing in India, the questions are a little different, very tricky. And as I said, the guidelines are very different. So you should have a different preparation strategy. In my case, I had a group of my friends, like we were study partners and we used to discuss questions, because I'll come to it. There is something called as recalls, that is past questions. So these questions, they are not, there's no real true answer that you can find anywhere. So by once you start solving past questions, it's past year's questions, past year's papers, that's called recalls. It gets quite tricky. So I think preparation strategy is very important. And of course, everything depends on hard work. Okay, before we get started to the topic proper, these are the top 10 FAQs that I am mostly asked. And let's quickly go through all of them. I think I forgot to mention this in the beginning. If any of you have any other doubts that I am not clear on, or you want me to say something more about it, please, I think, comment down. We can take up these questions later. Okay, so coming back, what is MRCS? So MRCS stands for Member of the Royal College of Surgeons, and it's a postgraduate qualification exam. And RCS, that is Royal College of Surgeons, there are 4 Royal College of Surgeons. That is one in the England, one Edinburgh, one Glasgow, and the other one's in Ireland. So all 4 colleges conduct their own MRCS exams. So once you take up MRCS Part A from either of these colleges, you have cleared MRCS Part A, but you can take up Part B from any of the other colleges as well. You don't have to take up, for example, if you take up MRCS Part A from England, you don't necessarily have to take Part B from England too. And the Part B, which college you take Part B from is what member you'll become. For example, if you take MRCS Part B from Edinburgh, you will be a member of the Royal College of Edinburgh and not England, because England was just Part A. So that is it. That's MRCS. PLAB versus MRCS. So again, MRCS is a postgraduate qualification exam. It's a diploma degree. After you clear both the Part A and the Part B exams, you will get a diploma, right? So there'll be a graduation ceremony in the Royal College and you will get a diploma certificate. Whereas PLAB is a licensing exam, PLAB 1 and PLAB 2. Once you clear it, you just get a GMC. There's no diploma, there's no graduation. It's just a licensing exam. Are post-MBBS students eligible? So this is my most favorite question, because I had this doubt and a lot of my friends had this doubt. And yes, post-MBBS students are very much eligible. The only thing that is there in the eligible criteria is that you must have a valid PMQ, that is the primary medical qualification. So once you have your degree certificate, that is all that matters. You can apply your Part A, you can even apply your Part B, right? You can finish both these exams with just a MBBS degree certificate or a PMQ. So how many months of preparation is required? Personally, what I took was exactly 4 months, and that's what's recommended. I didn't want to take chances, and I did 4 months preparation. But again, this depends on how much time you can, dedicate to the exam itself, and how long can you prepare, how many hours a day can you prepare, and based on your individual preparation strategies itself, it matters. So how many times a year is the exam conducted? The exam is conducted 3 times a year. Every year, it's always these 3 times, except the COVID years, because of all the things that happened. There were no exams conducted during COVID. But every other year, there is a January exam. There's a April or May exam. There's an April or May exam, and there is a September exam. So the 3 exams every year. So right now it's July. I think the September must still be open. You can check out the RCS college, any college websites. You can check out RCS England, RCS Edinburgh websites to check the dates of the exam. There will be one in September. There'll be another one next year in Jan. So should I pass PLAB 1 and PLAB 2 to take up MRCS? Absolutely not. As I've already said, for MBBS, just MBBS is enough. Just a primary medical qualification is enough. You don't need a PLAB 1 or PLAB 2 to take up MRCS. Do I need to have surgical experience to clear the exam? No. Again, it might be advantageous. Some people say it's great, so you'll have the knowledge already. You just have to work on the theoretical part. So surgical experience always is good. But even if you don't have it, it's okay. You can easily clear this exam if you follow the course. All right, so resources. Resources, again, is a huge, huge topic. There are a lot of things that there are question banks. There's the one that I followed is called emrcs.com. And there's past test, MRCS. Okay, so these 2 are the very popular ones. Then there's more YouTube videos are very, very good. We'll come to the pattern of the exam. So once we come to the pattern of the exam, you will know that anatomy holds very, very the major chunk of the marks. So for anatomy, I would recommend Ackland's video. There's something called as RCS Edinburgh's affiliate program, and you can become an affiliate for free. You can be an affiliate of the RCS Edinburgh for free. You can go to the website and you can follow the instructions. And once you have become the affiliate, you have Auckland's for free. Auckland's anatomy is a free resource. So that's for anatomy. Apart from that, a lot of other books like Raftery is necessary, but I didn't go through it. Apart from that, okay, we're coming to the 9th question. Is MRCS required to do surgical residency in the UK? Again, so to get into CT1, you don't need MRCS. Earlier there was a scoring where you would get particular marks, some marks, if you have cleared MRCS Part A. But now even that's not there, so that was removed. So MRCS basically doesn't hold any importance in getting into core surgical training, but it might help you stand out in the interview selection process. But to get into specialty training, that is ST3 onwards, you need to have cleared both the parts of MRCS, A and B. And coming to the most important pattern of the exam that we'll go through detail is this. So exam in itself is a 300-mark paper. I'm sorry, so that's a 5-hour long paper with 2 papers. So there is part A, paper 1 and paper 2 of part A, right? So paper 1 is 3 hours, and then there's a 1-hour break where you can have lunch. And then there's 2 hours again of principles of general surgery in general. So as you can see here again, anatomy is a major chunk. There's 75 marks. That is almost 25% of the entire MRCS Part A is anatomy in itself. Then we have physiology, pathology, pharmacology, microbiology, imaging, data interpretation, and auditing. So this is just 3. And I'm sorry. And paper 2 is principles of surgery in general. So if you have surgical experience, this is where you can, outshine the post MBBS candidates. But I think this is enough for just, post MBBS candidates. The paper 1 is all the post MBBS candidates game. So coming to paper 2, we have common and acquired surgical conditions. There's perioperative management, trauma, surgical care of children, and medical legal issues. So that is again 3. So all of these medical legal issues, something very peculiar to the UK itself. So if with just NEET, you will not be able to, it's going to be difficult to crack these topics. Okay, so if I would want to ask, I know, Kanika, can I ask them? So I just wanted to know what your expectations from this 10 hours of training is.
Sure. Doctors, you can raise your hand. I can unmute you, or else you can put your response in the Q&A section itself.
Yeah, okay. Okay, if, okay, I think we can move ahead. So this is what we have come up with. There are 10 hours of sessions. We have divided it accordingly. Since anatomy holds a very important chunk, we have 2 hours of anatomy. We'll be doing a topic now itself, and then we'll go on with anatomy on Saturday, physiology, pathology, pre and post-operative, clinical microbiology, statistics and legal issues, gastroenterology, breast, endocrine and vascular surgery, trauma orthopedics, urology, head and neck surgery. Again, all these 10 hours will not include everything that you'll need to know, right? So it's just some important topics that I will be able to cover in 1 hour. And these are mostly some of the most repeatedly commonly asked questions that I have found in my preparation and in my exam. So these are high yield topics that I'll be covering in each session. right? So again, so this is a fully live interactive session on high yielding topics. There will be personal tips and tricks on preparation strategies, personally how I prepared and how I saw my friends prepare, especially for doctors that are working full time. So I was working full time, and yeah, so how you can manage your time and how many hours of time will you have to put in. And we'll also do some mock MCQs. I think we'll start them now, and we'll discuss on how to solve the MCQs and how to rule them out and stuff. Okay, so before we go to the topic in proper, Kanika, can we have the polls? So what we'll basically do is have a pre-test. We'll assess, we'll see how much we already know, and then I'll build on it. I will take the session, and by the end of it, we'll also have the poll. We'll have a pass test. So this is a pre-test poll. There's a pass test where we'll have the same questions again, and then I think you'll know where you stand after attending the class. Okay, I think we can give them 5 minutes to, or few minutes to just give these 5 questions that are present on the screen.
I request all the participants to please respond to the poll.
I think we already gave this poll, did we?
No, doctor, they can scroll down and they can see the rest of the polls.
Okay.
If there is any issue, if you can't see the poll, please do let me know in the Q&A section. If the poll is not visible, okay, we are getting the responses. Doctor, you want me to like keep active poll for 5 minutes or
Yeah,
3 minutes?
I think 3
Okay.
minutes is fine. We can, I think we're already running late.
Yes.
Or it's fine. I think it's 2:30. 1 more minute.
Yep.
It's too long. A minute. It's it's actually the real exam is like that. So it's 300 marks, 300 minutes. No, I don't think so. It's actually less. Yeah. Okay. Okay, can we start?
Yes, I will show the results.
Yeah. Did you show it to me? I can't see it. Oh, yeah, okay.
Can you see the results, doctor?
Yeah. Okay, great. Can this be displayed later too, with the post test, the results for this?
I'll try. I will try.
Okay.
Go
Yeah,
ahead.
we'll
Yes.
see. Okay. Okay. So we'll come to the topic proper now. Do you guys have an idea on what this is? This is a picture from Macmillan's. I think I already showed the answer. I think anybody can unmute and raise your hand, and it should be an interactive session. I would like somebody to talk. It will be nice if somebody can talk and answer some questions while we're discussing it. Okay, we'll move forward. So this is actually the thoracic inlet and the superior mediastinal area. So today's discussion is on mediastinum. Yeah, okay, mediastinum. So what is mediastinum? It's the region between the pulmonary cavities, and it is covered by the mediastinal pleura, and it does not contain the lungs on either side. So it only contains the heart and its structures, and apart from that. So it extends from the thoracic inlet, as we saw in the picture, to superiorly and diaphragm inferiorly. So how is it divided? So there's this picture here. I think everybody is, this is like a revision. I think most of us know it, right? So there is this line. Does anybody know where this line extends from? What is this point and what is this point? If
Dr.
anybody
There
can
are
answer.
responses in the Q&A section. Can you see that?
No, I don't think there are answers to what I'm asking.
Yes, there are no answers. Participants, you can answer all the questions in the Q&A section. Also,
Yes,
you can raise your
T4.
hand.
Right. Yes. So posteriorly it's T4. What about the anterior? Anteriorly, it's at the sternal angle of Lewis, right? So a line joining from the sternal angle to T4. Superior to that is the superior mediastinum, and inferior to that is the inferior mediastinum, and again that is divided into three. Okay, so we have anterior mediastinum, a middle mediastinum, and posterior mediastinum. So in MRCS Part A, what's very important is the contents of all of this and the basic anatomy of mediastinum and all the structures that are present in each of these areas. Okay, I think you have already solved some of the questions and you know what kind of questions are asked, so you can concentrate on it, on the topics that I'm discussing. So we'll come to superior mediastinum. Let's look at this diagram here. So this is that line that I've said, the level of sternal angle, from the sternal angle to the T4 posteriorly. So whatever is above it is superior mediastinum. So basically in part A, we have to revise and learn with pictures. So that's what I have learned. We have to just keep, memorizing these pictures. So what I did was I had a folder of pictures. When I was studying, I would just download some pictures that I found important. So what's the trick is you have to keep revising the same pictures. If you keep Googling another picture all the time, it's going to be difficult because it's another picture, and to memorize it, the pictorial memory, it'll be difficult. So just have some basic pictures that you will always go through to revise some basic anatomical topics. So coming back to this, we have arch of aorta, right? We have superior vena cava with left and right brachiocephalic veins, then brachiocephalic artery here, left common carotid, left subclavian, and there's trachea, right? We'll see again if we got those right. Yes, superior vena cava, brachiocephalic veins, the arch of aorta. Then here you can also see the thoracic duct that comes and joins the left subclavian artery here towards. Kanika, can you see the cursor that I'm showing?
Yes, doctor.
Yeah. Okay, so here we have the thoracic aorta that comes and drains into the left subclavian artery, and trachea, and the esophagus right behind it, then the thymus, and the vagus nerve, and the left recurrent laryngeal nerve, and the phrenic nerve. So these nerves are very, very important because they are it's always asked. Vagus nerve, phrenic nerve especially. I will come to those questions as well. So just remember these. So coming to what are the structures that are present at the manubriosternal angle. There's a very famous mnemonic for this. It's called the rat plant. So you know what the manubriosternal angle is, right? So whatever this angle, whatever structures passes through these angles are very, very important structures that you should remember, because there are always questions like somebody stabbed at this area. So what is not injured, what is injured, and stuff like that. So manubriosternal angle structures are very, very important. So rat plant, we have second rib and T4 vertebra. That is the level of the sternal angle and that line. So in beginning of the aortic arch that we saw in the picture, bifurcation of the trachea, bifurcation of the pulmonary trunk. So there's this other very nice mnemonic that's there, that at all the level of force, they leave. They bifurcate. So at C for the carotid bifurcates, at T for the trachea bifurcates, at L for the aorta bifurcates. So that's another mnemonic that you can remember. I think in the next classes, we'll talk about it. So bifurcation of the trachea, bifurcation of the pulmonary trunk, and the left recurrent laryngeal nerve. Here it loops under the arch of aorta. So the left one loops under the arch of aorta, the right one loops under the subclavian artery. Then ligamentum arteriosum also lies at this level. Zygous veins drains into the superior vena cava, and there are nerves that is around the cardiac plexus. There's thoracic duct that empties into the left subclavian vein. Right. So we saw all these things even in the previous picture. Coming to the anterior and the middle mediastinum, and what are the contents in either of these. So in the anterior mediastinum, we have thymic remnants, lymph nodes, and fat. This is very simple to remember. It's only these three. And this is, so it's not usually tested on. Anterior mediastinum is not tested on, but middle mediastinum is. I think one of the question was based on this. So middle mediastinum contents is pericardium, heart, aortic root, arch of azygous vein, and the main bronchi. So this is basically what's there near the heart, right? So the heart and surrounding pericardium, which the aortic root that leaves the heart, and the arch of azygous vein, and the main bronchi that is already divided. So in the superior mediastinum, we saw there is trachea, right? But at the level of T4, it bifurcates. So below it, that is at middle mediastinum, it becomes main bronchi. So that's one way of remembering it very logically. Coming to posterior mediastinum, this is again very important. These contents are very important. So we have from the superior mediastinum, we have a lot of things that comes downwards, that is esophagus. Then there's thoracic aorta, azygous vein, thoracic duct, vagus nerve, sympathetic nerve trunks, and splanchnic nerves. So I think this diagram, you can see this is like a lateral view, lateral aspect that you can see. There's superior mediastinum. Here's the neck. This is the thoracic inlet. The first diagram that I showed was in this part, that is the thoracic inlet. Right, so below that is the superior mediastinum here, and we've already seen the contents. So this is the transverse thoracic plane. Below that, we have anterior mediastinum. We have the middle mediastinum that contains the heart and the stuff with it. Then there is posterior mediastinum. Right, so something that's very, very important, that's always asked, is phrenic and vagus nerve, where it lies. Does it lie anteriorly or posteriorly? And this is something that I found so confusing that I always mark the wrong answer in the mocks. So remember, how I remember is vagus is posterior because the alphabet V comes later in ABCD. But again, logically, you can think about it that vagus goes down posteriorly, and it gives left recurrent laryngeal and right. This is from the left side, so we only see the left recurrent laryngeal nerve. And phrenic nerve goes anteriorly, and then it goes down to supply the diaphragm. Right, so this is again a very important picture. I thought it's nice to remember it like this. And apart from that, so there's aortic arch and the descending aorta. So then another very important question that they ask is on widening of the mediastinum. There's a very classical presentation where there is widening of the mediastinum. And I think we had this question, I had given this question. And is there rupture proximal to the aorta? arch of aorta or distal. That's always confusing. But if it is proximal to the arch of aorta, it is towards the heart, right? So will the patient come to the ED after a few hours? No, he probably would have died in transit. So that's again common sense. A person with a proximal aortic rupture, he couldn't have come. Only somebody with a descending aorta rupture is possible. Okay, that's again a question that we will be showing again, and I hope all of you get this right. Okay, so this is again another picture to imprint whatever I've taught you till now in your brains. So we have the right vagus nerve here, and this is the subclavian artery. So we have the right recurrent laryngeal going, looping around this, whereas the left loops around the arch of the aorta. This is again very important. And yeah. Okay. So let's have the polls again. And after the poll, we'll discuss and how to come to the answer. Kanika?
Doctor, you want me to show the results or you
No.
want?
That was the pre-test. I want them to answer the questions again. This is post-test.
Okay. Okay.
So I think you guys can take 2 minutes and we'll have a discussion about these questions.
Is the poll visible?
Yeah. Do we have answers? Here we.
Okay, 1 second. I will show. We still have time, actually. It's one.
No, we still have to discuss the answers and discuss their questions.
I hope the screen is visible. Can you see, Doctor, the response?
Yeah. Right. I think here now I can clearly see a lot of them have answered right answers. Okay. Right. Beautiful. So let's again discuss. Now I would actually want you all to unmute yourself and maybe talk, because we're going to discuss the same questions and we'll know how to solve it. If some of you have gotten it wrong, it's your chance to ask the questions and get your doubts cleared. Okay.
Anyone who wants to speak can raise your hand. I will give you an access to unmute.
Yeah, or you can just type in. Anything is fine, whatever suits for our participants. Okay, so the first question read the following. A man is stabbed in the chest to the right of the mandibulosternal angle. Which structure is least likely to be injured in this case? So this is very, very important to remember. It was the least likely thing. So we, in the heat of the exam, in the 3 hour, 5 hour long exam, we tend to, misread the least likely to most likely, and that's where we lose marks. So just make sure that you read the. So what I would do when I took the exam was I always kind of read the last line, because some of the questions were so big and most of them are useless information that actually absolutely made no sense. So I would try to read the last line and then understand what the question was asking us to do, and then read the entire line quickly. So time management is very important in this exam. Right, so here a man is stabbed in the chest to the right of the mandibulosternal angle. This is the rat plant. You should remember the rat plant, and this is very simple, right? So we've already discussed the rat plant. If you know rat plant, you can easily answer this question. So right pleura, trachea, right phrenic nerve, right recurrent laryngeal nerve, and brachiocephalic vein. Can someone take this question and maybe answer it? You can ask to unmute or just text on the group, I mean, on the chat or questions. Yes, perfect, doctor. Yes, Dr. Amanan Janvi. Perfect. So it's right recurrent laryngeal nerve. The right recurrent laryngeal nerve branches of the right vagus more proximally and arches posteriorly around the subclavian artery. I showed a picture previously. I'll show it again. So what's again very key in anatomy, especially because it's a very volatile subject, is you have to keep looking at those pictures and have that image in your mind, right? So of the structures given, it is least likely to be injured. Which structures does the left recurrent laryngeal nerve arch around? Any answer? Yes, perfect. We'll go through the picture again. It's the arch of aorta. The same picture, as I said, reiterate the same picture. So you have this in your mind. Finding the right pictures is again very important. So right vagus nerve, right recurrent goes around the subclavian. Here we have left, it goes around the arch of aorta. So at this level, if you can see this level, that was the manibrio. I think I can annotate, right? Okay. So this was the level, if I am not wrong, right? This was the level that that was given in the question, that is the mandibulosternal angle. So what's least likely is the left recurrent laryngeal, because it branches off superiorly. I hope this is clear. If you have any doubt, please ask me. Please let me know. Okay. So we have the second question. A 63-year-old man is undergoing an upper GI endoscopy for dysphagia. At 33 centimeters from the incisors, a malignant-looking stricture is encountered. Now the endoscopist attempts a balloon dilatation. Unfortunately, the tumor splits through the esophageal wall. Into which region will the esophageal contents now drain? So again, this is, all these information is kind of useless, but we'll see how to go about it. These are the options. Can someone tell me? Okay, posterior mediastinum. Right. So this is, so this, why this is important. Can somebody tell me why this is important actually? Can somebody tell me how 33 centimeters from the incisors is important? Right, Dr. Piyush. Correct, Dr. Kevin. Anybody knows why 33 centimeter? 3 strictures of esophagus, yes. So let's revise that. Let's revise the strictures of the esophagus. Okay, so the answer is indeed posterior mediastinum. At this point, the esophagus, as we've already said, is located in the posterior mediastinum. So here, constrictions of the esophagus is very important, because if it was beyond 40 centimeters, it goes under, it goes beyond the diaphragm. So it can even be a peritoneal cavity, right? So that's very important. 33 centimeters, very important. Again, this table is very important in MRCS Part A. So we haven't gone through this because it's a very different topic. It comes under GI and esophagus. Because of time constraints, I've only stuck to one topic, that is mediastinum, and we'll go in depth because it's very important and a lot of questions come from here. So this is because it's the first session, I thought we can, sensitize how the questions are asked and how preparation should be. Because once in NEET and other exams, we study extensively, right? So that is not required in MRCS. There are some things that are very, very, like, the Royal College wants the surgeons to know. They want us to know only these particular things. And so we should, study smart. So that's what we'll be learning in these sessions. What's more important and how to prioritize that while studying the other things. Okay, so again, here we have at cricoid cartilage, it's 15 centimeters. It's from the incisors here till the cricoid cartilage, 15 centimeters. Arch of aorta, it's 22.5 centimeters. Left principal bronchus is 27 centimeters. And diaphragmatic hiatus is 40 centimeters. So this table is very important. Okay, so again, we'll brush up posterior mediastinum, esophagus, thoracic aorta, azygous vein, and thoracic duct, vagus nerve. Here, the vagus nerve, sympathetic nerve trunk, and splanchnic nerves. Very, very important slide. Okay, moving on, we are going to the third question. During a gangland gunfire, a man is shot in the chest. The bullet passes through the middle mediastinum from the left to the right. Which of the following structure is least likely to be injured? Again, very simple, straightforward question. They're asking that something is passing through the middle mediastinum. This is just distracting. I started thinking, okay, so what's the first structure in the left side? But all of that is not important. Just go through the options. You will know that only one of them is not in the middle mediastinum. No, it's also, Dr. Aman, these questions are one single best answer questions. So there's no double two answers, there's just one answer. Okay, I think I should have mentioned this before. MRCS is just single best answer. There's one best answer and you have to choose that. There's no negative marking, there's just +1 or 0. Okay. Okay, right. I think one of our doctors got it right. Yes. I'm sorry. Okay. Right. So answer was indeed C, thoracic duct. Okay. Again, we should have pictorial memory to just try and remember. Anatomy is just that. So we'll see how each subjects can be cracked. So anatomy, as I'm saying, is just remember those pictures, go through videos, just remember the anatomy as such. Okay, pericardium, heart, aortic root, arch of azygous vein, and main bronchi. I think a doctor mentioned main bronchi, but we spoke about it, right? So at the level of T4, the trachea bifurcates. So superior to it, that is the superior mediastinum, is just the trachea. At the below T4, it becomes the main bronchi and the middle mediastinum. So main bronchi is present in the middle mediastinum. I think one of the doctors got confused there, but everybody else, fantastic. You remember all of the things that I've taught. Okay, which of the structures listed below are not located within the mediastinum? Again, very straightforward questions. But see, here I have put very straightforward questions. The questions in the exam can be a little more twisted, but read the questions and it's just the same thing that you already know. So we have thymus, we have heart, we have great vessels, arch of the azygous vein, and vertebral bodies. Vertebral bodies. Fantastic, Dr. Piyush. Yes. Yes. Vertebral bodies. This is actually a slightly tricky question. Let's go back to our first picture that we saw. So this was our mediastinum, right? So whatever is anterior to the posterior mediastinum is, anterior to the vertebra is posterior mediastinum. So as you can see in this diagram, whatever is light blue is the posterior mediastinum, and our vertebra is not light blue, right? So you can just remember that vertebra is not a part of the mediastinum, and whatever is in between it is, anterior to it is. Okay, our final question for tonight, today is this. It's a 19-year-old student involved in a head-on car collision. He complains of severe chest pain. A chest X-ray performed as a part of trauma CD shows widening of mediastinum. So this is a very classical thing that's, again, very frequently tested. I've put in all the very frequently tested questions here. So this, a patient with severe chest pain and widening of mediastinum, they want you to think aortic rupture. Okay, this is something that you should know. So this is again very classical, as I've said, severe chest pain, and an RTA is there. Severe chest pain shows widening of mediastinum. Think of rupture of aorta. It can't be distal esophagus rupture because we will not have widening of mediastinum in the X-ray. Can't be this either. It can't be left main bronchus rupture, and it can't be IVC rupture. This presentation is again very classical, and this is something that everybody needs to know. Okay, again, in this, I have mentioned in the class, if somebody has listened, will know the answer to this. Let's check the answer. C, what is C? No, this is again distal. Yes, Dr. Janvi is right. It's D. Dr. Aman is right. Again, as I have said in the class, so we should have ruled out all the other three. We should have ruled out distal esophagus, left main bronchus, and IVC. And the confusion lies only between proximal and distal part of the subclavian and of the rupture of aorta, right? So is it proximal or distal? Let's see what the text says. So the aorta may be injured in deceleration injuries, accidents. So this is again a very key point. There are lots of questions that says deceleration, severe chest pain, and widening of mediastinum. You should always think of aortic rupture. Okay, in the setting of deceleration injury, chest pain, and mediastinal widening, the most likely problem is aortic rupture, right? So this will typically occur distal to the subclavian angle. This is very typical. But proximal aorta may also occur. However, the survival is unlikely. So our patient here, he had a head-on car collision and he came to the ED and he says he complains of severe chest pain. So there was so much time. He wouldn't have survived if it was a proximal aorta. So again, it says it is important to note that the question uses the term most likely injury, and that's how you have to differentiate between the proximal and the distal part. That is the ascending aorta, aortic rupture, and the descending aortic rupture. I think that should be clear. Yes, would die only, exactly. Right, perfect. So I think this brings us to the end. Let's take up some questions regarding today's session or MRCS Part A in general. If there's something that somebody wants to know, something regarding mediastinum itself or something other than it. Okay, Kanika, I will start taking the questions that were asked in the very beginning.
Yes, doctor.
Yeah. So Dr. Vasu has asked about the resources. So again, resources, there are a lot of resources, and what's important is what resource is best for you. You have to choose what's best for you. So I will tell you, sorry. Yeah, so mainly there are a few question banks, that is EMRCS and Past Test. EMRCS is the one that I personally will recommend, but you can take Past Test too. EMRCS is basically a lot of questions that are there, and it has some material as well. But again, there is something that you should know, that these UK exams, MRCS especially, does not have one comprehensive material. Like there's no one resource that has everything. So you have to keep looking out for so many other resources. So one of them is again EMRCS or Past Test, that is a question bank. Then there are some books. It's called Basic Science from Raftery. And I also looked up the first aid book for USMLE. So that was very important for me, some to brush up my basic sciences, and to help with remembering them easily. And apart from that, YouTube videos, because anatomy, again, as I said, it's very, very important. It's almost 75 out of 300 marks is just anatomy. So you have to have your anatomy very strong. As I said, RCS Edinburgh has free affiliate. Like you can become the affiliate of RCS Edinburgh very easily now. It's free of cost, and that has free Auckland videos. You can watch the free Auckland anatomy videos from there. And again, study smart. Don't just look at don't study everything. Okay, so questions related to MRCS Part A syllabus will be discussed. Yes, I think this was the expectations. The questions and the topics that are high yield will be discussed, right? Then, can MBBS MRCS work at consultant level? So at where are you asking? In India? I don't think so. Again, it depends on where. In the UK, you have to have finished your training. You have to have finished core surgical training, specialty training to have become a consultant. You have to have cleared even the FRCS to be a consultant. In India, it depends on your CV, I think. And I think you should have surgical experience. You can't just become a consultant clearing 2 exams. That is part A and part B. Right. I hope I am answering the questions. If you have some more doubts, you can please put it up here. Is this schedule mainly focused on September exam? I'm afraid not. We are not focusing on any of the exams right now. It's just 10 hours of very basic, important things to give orientation about the exam as such, and how somebody should study each topics. And we'll only be focusing on some topics, not all the topics, because we only have 10 hours, and 10 hours is not enough to cover the entire syllabus of MRCS Part A. I think the schedule is put up on Instagram as well. Please go through it. And so like today was mediastinum. The next anatomy session will be a few topics. For example, the aorta and subclavian axillary arteries, some very important, confusing topics. A few very important topics is what I will be discussing. Okay. Are questions this straight in the exam? No, the questions are actually not this straight in the exams, but not all the questions are this straight in the exam. Some questions are actually this straight in the exam, yes. So I remember taking the exam. I was very scared during the exam, but turns out all the mocks, it was quite like a mock. I don't know if that was just the January exam, but I've heard my seniors and my friends and colleagues say that some of the exams are like that. And I think once you start your preparation, there are some things called as recalls. And I think if we have a course, we will go through the recalls in elaboration. We'll elaborate on the recalls. And once you start doing those mocks, and So then you'll know exactly how the questions are going to be. And some questions are actually just one phrase or one sentence. What are the contents is all of the following are contents of middle mediastinum except can be a question. You never know. You just have to be lucky to have such a straight question. Can you tell the resources of anatomy? So I think I've already answered this. Any coaching classes suggestions? See, I can't suggest coaching classes because I didn't take any coaching classes. I studied on my own. I made my own notes, and I had to go through a lot of, as I said, resources to actually make a very compiled notes and go through it again. But there are lots of coaching classes if you are required. You can Google it up. There are lots of coaching classes, but I don't think I am someone who can answer that because I don't have it. Okay, ma'am, will there be major difference in basic science book edition 3 and 4? I don't think so. There won't be any major difference. All the contents will be the same. Maybe the updates will be different. Like maybe if there's a protocol, there'll be a nice guideline. If there is a newer nice guidelines that have come, so that can be something different. That's it. Hello, is your preparation for in your preparation for MRCS, did you focus on single MCQ source such as EMRCS, or would you say to focus on multiple sources and go through both? Okay, so this I'm sorry, Dr. Chaitanya, how much time do you have for preparation? If you have like 6 months and if you have a lot of time to prepare, I think you can go through both, but no, I focused on one. And I think it worked out. And as far as I've heard, EMRCS is mainly, it has the similar questions that will reflect how the real exam questions are. Past test is very vast. It has some questions that will not be tested. And so you can take up past test. I'm not discouraging you, but EMRCS would be better. And it will be nice if you can focus on one. If you have time, I think you can. If you want your preparation to be very comprehensive, you can do both. Among 4 colleges, which one is the best to opt? Again, this is very personal, this is very individualistic. So you can go through all the websites and there are benefits of each member. Like in England, there are some benefits. Edinburgh, there are some benefits. So it's basically like a family as such. So I had attended one of the RCS course for Part B that I'm preparing for. And it actually felt like a nice family. I was with RCS Edinburgh members. And you just have to choose which one you'll want to be a part of. Again, each college have their own membership benefits. Whatever suits you, whatever you want, you feel like doing, you can take up anything. What is your suggestion about the resource? So yes, basic science for MRCS by Daftari. This one, as I said, this is something that all my seniors recommended me to study. So I was supposed to do this, but I didn't. Okay, so I didn't go through basic science at all. So again, if you feel like your concepts are a little tricky, if you want to go through a textbook per se to understand it, you can for sure go through this resource. But if you are confident about your foundation, during MBBS, what you've studied, if you're confident, you can just start off with any EMRCS or something like that. So applied for this September's MRCS. Okay. Also, how to access reliable recalls, ma'am. Again, this is very tricky. So recalls, there's no reliable recalls. You will have to find your own answers. I'm sorry, I can't help with this. Okay, yeah, I've applied for this September's MRCS, started prep last month. Only have finished only surgery so far from my notes and MRCS questions for surgery. Can you roughly give her how to prepare for paper 1 in these 2 months? Going to start anatomy after your session also. Thank you so much. This is a lovely session. Okay. So how are you going to start? I hope you have time. And are you working, Dr. Janvi? I'm not sure if you're working, but I would like you to at least give 5 hours. No, okay, so that's great. So you can study all day. So go ahead, study all day. I would recommend you do EMRCS at least 3 times. At least the entire EMRCS you have to do 3 times. The first time, like how I did the first time I went through MRCS and made notes, like important ones or some things that I've kept forgetting. The key points like pearls, I wrote it down in a book. The second time was it took a little lesser time to do it, and then the third time I think I did it in 15 days. So something like that. Prepare for paper one specifically. So I didn't prepare just for paper one or paper two specifically, so I can't tell you that, but just go through EMRCS. Again, you can, I think, just select those topics and start doing the questions and keep practicing the same things again and again, and then go to recalls. I hope I cleared your question. Thank you for attending. I'm joining MS surgery in this NEET counseling. How should I utilize MS surgery in excelling MRCS clearing, like do's and don'ts? Okay, so I don't think there's something that you should do particularly in MS surgery to clear MRCS, because MRCS is very basic. Even an MBBS graduate can clear it. But I think you can try and maybe, so we have pre-operative, post-operative care, and how you can look at patient care. Again, that's very different in India and in the UK. So I don't think there's a lot that you can do, but just keep studying, stay in touch with anatomy. And if possible, you can actually try and clear MRCS Part A now, because I've heard post-MS surgeons who kind of struggle with their basic sciences after 3 years of MS training. It's just a suggestion, you can think about it. But yes, you can, there's nothing in particular that you would want to do in MS, during MS, to excel in MRCS. I hope that cleared your answer. Thank you. Question. Thank you. Is 4 months enough with a full-time job for MRCS, or do we have to focus just on the exam? Dr. Kevin, I was a resident in Enhance for full-time when I was preparing for MRCS. Yes, I had a full-time job and I somehow managed to do it. So I think 4-5 hours of dedicated study is enough. You can study 4-5 hours every day. Just make sure you show up. Make sure you study every day and be consistent, and that will surely give you success. And it's possible. A lot of doctors do it when they are doing a full-time job. So you can do it. All the best, Dr. Kevin. I think you should do it. From where should we study for surgery paper 2? Again, I think the same resources. There's no specific. Again, you can study from Rhapsody. There are 2 books for paper 1 and paper 2, but there are same resources that are there. You can study from EMRCS, and there are past tests. And again, the same Rhapsody books. It's the same thing. There's no separate study material as such. Okay, how to become an affiliate? Yes, Auckland Anatomy is free. So go to your RCS Edinburgh website, and I don't remember how the steps are, but I think you can go to the website and you can find affiliate, whatever. So you just have to log in, sign up first, or have an account on RCS, and then there'll be an affiliate membership area. You can become an affiliate. That is for free. After you are an affiliate, there are a lot of benefits from the RCS Edinburgh that I have also recently found out after I went to this RCS Edinburgh course. So yes, Auckland Anatomy is free. You can study that for Part A, Part B, and for other purposes as well. Yes, I think there are no more answers for now. I hope I answered everything. Is there anything that is required to be answered? Please let me know.
Now anyone who wants to speak with the doctor can raise your hand. I will give you a permission to speak. Also, I request all the participants to give your valuable feedback. There are very few doctors who have filled the feedback form till now. So I request everyone to give your feedback before you leave. And also you can raise your hand. I will give you an access to speak.
Thank you. I think that's all. Portfolio Plus program. Should I subscribe, ma'am? I don't know what this means. I'm sorry. Doctor, what is the Portfolio Plus program? Okay, if there's anything else, okay, somebody wants to talk.
Hello.
Hello. Hi, doctor.
Yeah, good afternoon, madam. Thank you for the session. It was great.
Thank you.
I've got one doubt regarding the paper two preparation, the surgery part, surgery and orthopedics. You mentioned the book of Raftery, correct?
Yeah.
Ma'am, I searched for that the Raftery book. It's for the basic sciences. I could not find for surgery and orthopedics.
I think there
I
are
guess
two
it's
parts. Okay.
I think it's Bailey and Law and the other book, the orthopedic, which is study in MBBS, the Maheshwari one. Raftery, I could not find the surgery book.
Okay. I'm sorry, but I think there are two parts. I will go through it once again, and maybe next session I will tell you. But personally, I did not prepare from those textbooks, so I cannot tell you that it is great and you should study it to pass the exam. So I think you can just go through your MBBS books for revision, and there are lots of PDFs that are available. I think I can make a drive just for the PDFs. Let's see if you can just go through them. That is required. I think that's sufficient.
Okay, madam, actually, I'm studying from the basic sciences book, the Raftery book, for the part
Okay.
one.
Okay.
And for part two, I was just a bit confused whether to study from
Paper two.
Bailey and Law because that's a huge, like it's got a good chunk of subject in that. But since you mentioned Raftery, so I just asked this thing.
Okay. Have you subscribed to any question banks?
Not yet, ma'am. Actually, I cleared my lab two, got registered, and I'm about to start my job in UK. So I've got a like 1 year period with me. So I'm
Yeah.
like going through all the books first, and then I'll start with the MCQ.
Okay. But I still think it's easier if you can just start with your EMRCS. There is a open textbook, right? So there is an inbuilt textbook. There are some inbuilt topics that you can revise from EMRCS itself.
Okay.
Okay, so that's
Okay.
what I prepared from, and that's
Okay,
very
ma'am.
to the point, and you can study from them instead of studying
Okay.
a lot of things that probably will not help.
Okay. Okay, ma'am. Thank you.
Thank you.
I think we are done with the Q&A. Thank you so much, doctor, for such a wonderful session today. And see you all in the next session. Thank you so much, doctor. You can leave, doctor. I'll just collect the feedback
Thank you.
from everyone. Thank you so much, doctor, for your
Bye.
time. Bye-bye.
Thanks, guys. Thank you. And please submit feedback, as Kanika has said. It will be very important for us. So then I will improve if there's something that you would want me to do differently. Maybe the next class, the next session, I can improve on that as well. Thank you so much. Bye. See you on 8th July next.